so much. And it's wonderful to see a lot of people in this room that I have known. Jackie and I were just reminiscing that for me, this all started at the Arizona Community Center in 2000 with Dr. Kravitz. And I was brought in to work on a kind of city, school-based mental health initiative on infant brain development. And I told Sandi, I said, I don't know anything about philanthropy, I don't know anything about nonprofits, but I do know kids. And I know little brains and big brains, and so that was the door opened for me, and I was just so fortunate to be a part of this community. So thank you. I also moved to Phoenix from the White Mountain Apache tribe. So I have been a clinical psychologist, child psychologist with the tribe, working in different schools and different types of schools. So boarding schools, BIA schools, community schools, and state-funded schools. And it gave me this wonderful opportunity to really be there for 7 years and work on mental health issues within the tribal community. So this is an issue that's very near and dear to my heart. One of the things that we know in oral health is that it is the gateway to the rest of your body. Your dentist can diagnose more than 160 different diseases and conditions just by looking in your mouth. And a lot of people know that kind of, it makes sense, it's intuitive, but at the same time, they're kind of surprised that your dentist can really be such a healthcare provider for you in that way. And so we're trying to get that message out. And Delta Dental of Arizona Foundation was really created 16 years ago now to be that nonprofit charitable arm of the insurance company, because we know if you don't have dental insurance, you're much less likely to get dental care. So that's one of the critical factors, is people with dental insurance are twice as likely to go out and seek care because they do have some coverage, and we know that's a big deal. So today, the collaboration we've been working on has several different partners, and I'm not sure, is this the clicker I'm supposed to use, Emma? Mm-hmm. Okay, great. Let's see. So for those of you who don't know, and I'm not going to read all of these, early childhood caries is epidemic among American Indian and Alaskan Native populations, and that is across the United States. And that is a very severe form of dental disease, and we're seeing it in American Indian children as young as 6 to 7 months old. Wow. So it's a transmissible Streptococcus mitan bacteria, and it's passed from spit. I do a lot of work on spit. One of these days I'm going to title one of my presentations Spit, because we talk a lot about saliva, we talk a lot about transmission of that bacteria from the caregiver to the child. Most children don't, they have some immunity to dental disease, to that type of disease and bacteria, unless they come out in a C-section birth. If they do, they're usually sterile. They don't have any of that. And unfortunately, what we're seeing now is if they are born C-section, they actually can get dental disease and get a worse or more severe case of disease because they don't have the same protective factors that you see in a vaginal birth. So, but I'm getting way too technical. Did everybody eat? Okay. So one of the things that the oral health community is concerned about nationally is really looking at why do American Indian and Alaska Native children develop dental disease in a more severe form and earlier. So they're looking at the epidemiology and the science behind that, the genetics behind that, and fortunately at Delta we're able to support some of that work that's going on nationally. So there are dentists who are amazing researchers, and they are meeting every 3 to 6 months across the country working on some of these issues and doing studies trying to figure out why that's the case. But in the meantime, of course, we've got lots of children, very young age, with bombed out mouths. And primary teeth are still important. Even though they fall out, those primary teeth serve an incredible purpose. They keep the placeholder in the gums for the teeth to come out, permanent teeth. They also help children develop their speech and language. They help, of course, with their nutrition, because you can't eat very well if you don't have strong teeth in place. So all of those things make for a real critical developmental period in early childhood for those primary teeth. Really important for them to keep that. Indian Health Service is primarily the service provider on a lot of reservations. Some are compacting, 638, so you're seeing tribal service organizations for health that are springing up, but most are still underfunded and don't have enough access to care. There are not enough dentists in remote areas particularly, or on reservations to serve the population. In Arizona, we've got some mid-level providers, affiliated practice dental hygienists. Their scope of work is expanded, so they're able to do a lot of preventive work, but they don't always get reimbursed for all of that work. And as all of us in this room know, money makes things happen. If there isn't money and reimbursement, then those services are not provided typically. The other thing is tribal communities don't always respond to the same kinds of outreach programs that other communities do. So you really have to tailor those to a specific community. And if you've worked with a tribe, you've worked with that tribe. You can't generalize to all tribal communities. The cultural issues are different, and some tribes have a long, long history of hostility and conflict between them, between tribes, and that's one of the things that we've had to pay attention to in this particular coalition. They also tend to avoid preventive care and wait until there's pain, infection, and other things involved before they reach out and get the restorative care or fixing bad teeth. And if I start speaking a different language, dentalese, just let me know, because that's one of the things that happens sometimes in this line of work. Work with a lot of dentists. This is an example. Native Health is a federally qualified community health center here on Central Avenue. They serve a broad urban Indian population, and this is an example where you see a tribal provider with a tribal child, and that's one of the real keys that we're finding in our coalition. So this program started in 2011. It was originally funded by the DentaQuest Foundation. DentaQuest is a foundation that grew from Delta Dental of Massachusetts. They did very, very well, created a separate corpus and foundation, and that corpus has grown significantly and is now funding across the United States. We're fortunate in Arizona to be a partner with them. So Delta Dental of Arizona Foundation is doing matching money, and we've been involved with them over the period of the last 3 years, and I'll talk a little bit about the different stages that we've been involved with. They have 3 funding areas, and one is on building the capacity of the public health infrastructure and prevention, and that's the area of funding that the Arizona American Indian Oral Health Coalition fits into. And I'll have to say that really slowly because I'm trip up where I'm at. If you haven't heard about DentaQuest, they have a tremendous amount of resources. They're leading some national efforts that we're involved with as well. One is an oral health funders collaborative, bless you. And there are about 20 foundations nationally that are involved in oral health as a primary focus. the Robert Wood Johnson Foundation, the Kellogg Foundation. There are 5 deltas, myself included, that are from different states like Washington, Iowa, and Colorado, that are all, South Dakota, that are all involved, and some other smaller health foundations in different states like Kansas. And most of those are healthcare conversion foundations, so similar to our St. Luke's Health Initiatives or the BHHS Legacy Foundation, which are both healthcare conversions here. One of the deliverables the first year of planning was to host a summit. And the summit was really intended to raise the visibility of oral health within the tribal communities, to really get some engagement at the tribal level and figure out which tribes might be interested in this. Right out of the gate, politics were involved. There were 2 applicants from Arizona. The one that didn't get the grant didn't want to participate. And we won't go into the specifics. 3 years later, they've come around, and that's great, because again, you start to see that splintering and fragmentation really early on with key players, and it's difficult then to engage partners. But it was a broad group that kind of came together around hosting a summit to try to help raise the visibility of oral health across the lifespan, not just for kids or elders. And then to bring those people and hopefully get some commitment from them about where do we go from here. They also created a publication, a report, and those of us that were on the planning committee participated in that, and collecting that report, editing that report, producing that report. That was a great deliverable because it's a super issue for anybody interested in health and Indian people across the state. It's out there on the web, and it also helped with bringing in more partners over time. Got a lot of great visibility in dental magazines, like Inscriptions, which is the Arizona Dental Association's journal here in Arizona, and some other places like that. So that also helped give it some credibility, which was really important for this effort. The tribes were looking for that, and one of the things we found was that we didn't speak the same languages at all when we first started coming together. So we had a lot of dentists and dental hygienists in the room and dental assistants with a lot of tribal people. And the languages were really difficult to understand. There were also Western and Indian cultural issues that we were facing in terms of how to move the agenda forward, the speed of it, the consensus, and the amount of time that it would take. So conversation, discussion, dialogue was much lengthier and moved at a slower pace, and that was one of the learnings that we had.
Before you go on to that,
yeah.
Going back, the tribal ways are different in contrast to oral health leader ways. Or is that what you were talking about, communication, or is it specific to?
Some of it, well, most of it was communication issues. It was also, they wanted to do something around oral health, but they really didn't have the knowledge to even know where to start with it. And so that was one of the things we found. Going right to tribal council was really critical, to engage the tribal council, get the tribal health authority involved, whoever that representative was within the tribe, and really respecting the sovereign nation status, of course, is a huge issue, and working through that. So those were some of the pieces of this. And it required going to the tribal councils, making presentations, and talking about basic oral health information before you started the dialogue about what were their needs on each reservation. So we set up regional meetings all across the state, involved those champions, and it was real important to find a champion. So I'm not taking it personally, Kelly. Good luck with the merger. One of our learnings was that really basic oral health information, like how to brush properly, how to brush your children's teeth properly, what kind of care for elder people should be happening, especially for people that are medically either homebound, disabled, frail, medically frail. All of those issues. Your oral health actually gets more complicated as you age, which I'm unfortunately finding out. But that's one of the things that you see across the lifespan, your oral health needs and care shift. And so the tribes were really trying to understand what the needs were at each developmental level. But having that champion within each tribe was so important because they were the spokesperson then, the tribal spokesperson, not the dental spokesperson. They could call in the dental people when they needed some knowledge, some expertise, some supplies, resources, whatever, but it was really critical, and we were finding that more and more. One of the big things about technology is I work in a high-tech industry in the insurance business, and you forget that we still have areas of the state with very limited connectivity, and we can't even send emails out to everybody within the group. So we're still reliant on basic, letters in the postal service. That's hard because so many of us are used to working at a fast pace and communicating and hearing back from people. And again, it was a difference in a rural versus urban area, but also a tribal versus non-tribal community. So that was one of the things we've had to work around as a coalition. There's about 20 of us on the planning or steering committee. Again, very broad range of funders. First Things First has been part of that steering committee, and we appreciate that. We've also had the State of Arizona Department of Health Services and their Indian Affairs representatives, so that's been great. Hygiene and dentists have both been represented, which is super, and then a couple of funding organizations, so it's been a real nice diversity. One of the big things that we made a mistake on during the length of this project so far is creating a governance structure that won't work for the tribes. So it's a very Western-based governance structure, very democratic. Everybody gets a vote. Everybody gets one vote. Well, that's just not going to fly. The big tribes are like, well, we should have more than one vote. We've got more people. We represent more assets. We have more land. So we're really starting to work through how can a governance structure for this coalition reflect and respect the tribal organizations in this coalition. So I don't have any answers yet. We're working through that right now, but we'll keep you posted. And also really taking into account the cultural differences. So what may be a tradition in one tribe is not a tradition in another. And again, there may be long-standing hostility or conflict that may, again, still be playing out within that organization, within the tribes. So here's where we are right now. We're really trying to align the funding with the programmatic and service steps that each tribe wants to take. So in our role at Delta Dental, we're offering, our grant cycle is open right now. It offers up to $25,000 per grant for preventive dental services for children, youth, and pregnant mothers. So we're hoping the tribes will take advantage of that and get money to supplement their oral health agenda in each tribe for those populations. And it doesn't have to be all those populations, it can be subsets of those populations, because we know some of this has to do with parenting practices. It also has to do with dietary choices and practices, as well as the disease itself, which we know is highly infectious and transmissible. And then the lead nonprofit is really the one trying to negotiate how this governance structure is going to work. And DentaQuest Foundation has been very supportive. My hope is they will continue to be so over the long term, because I think one of our learnings has been, again, this work goes more slowly, perhaps, than other work because of the cross-cultural nature of it and the cross-discipline nature of it with the dental learnings. This is a snapshot I love, because this is a health center up on the Navajo reservation. Not something we see very often down here in the valley. We've got a nice little drumming group going on here, right in the middle of the health center with some great kiddos. So I just listed a couple of things. I've already touched on them, but one is never make assumptions about your partners. Really check those out. I think that was something we learned the hard way, is that there were some assumptions made, especially when it came to the governance and the next steps, and those really needed to be completely vetted in a good due diligence process with the tribes. And I don't think that was done as much. And I think the others, involvement has to be meaningful and have some power, and not just be a function solely of the money involved in the grant. And I think that's another somewhat difficult thing to create, but is really important when you're working with many different communities like this. I love this because it had the word grants in it. But you've also got the billboard with the smoke shop. And McDonald's, right. So talk about diabetes and long-term health issues. There are specific protocols for oral health if you're diabetic. That is, again, a rampant chronic condition for Indian tribes. Smoke, smokeless tobacco, chew tobacco, whatever you want to call it, is a huge, huge no-no in my business, of course, because of the rate of oral cancer. So those carcinogens get right into your mouth through the tissues and go systemically through your body. So one of our prevention messages is always to try to reduce chew or smokeless tobacco, especially in teenagers and also in certain sports, which we tend to see a higher prevalence in certain sports like baseball. So we're really trying to move forward some prevention messaging and things like that. Any questions?
Sandy?
Yeah.
Just to underline your point about size, there are 18 federally recognized tribes in Arizona. The smallest one's under 1,000, and the Navajo are over 300,000.
Exactly.
Just to give you a sense of the range of size of the tribes.
Right. And the larger tribes, a few of them have said, we really want to do our own thing all together, just give us the money and let us go. And of course, the whole point of coalition is not to do that, and to try to envelop people. And so again, you get into these kind of power differentials and influence differentials, size differentials, size does matter. And so those are the things that we're really trying to pay attention to as we move forward. But with sensitivity and I think much greater cultural awareness, I'm pleased that DentaQuest has taken our tribal representatives on this project. We have a project coordinator and a project assistant, and they're going to be teaching the other grantees for DentaQuest about cultural sensitivity and awareness, and I think that's wonderful. It's wonderful for Arizona, and it's wonderful for that foundation to really understand some of the differences, and I think they'll get a lot of value for that. Yeah.
Sandi, you mentioned about staying with things for the long term. That was one of your bullet points. At what point do you feel like, how do you know when you've gone as far as you're going to go?
I wish I had a good answer for that. I think that every foundation varies somewhat anyway, and some have kind of very strict parameters around the length of particularly multiple year funding. I know DentaQuest is looking at that, and I think their board will be challenged with this particular coalition about how many years you go down the road. When I was in Indian country, I used to say, I don't care how small or how big the idea is going to take a year to talk through, to walk through, to figure out how to do it. Everything's going to take at least a year. And it might be something that could take a couple of weeks or a couple of months outside of a tribal community, but it's going to take much longer to bring everybody together and to make a systems change. And that's part of what we're trying to do here, is really look at systems and awareness about oral health, integrating oral health into overall health for the tribes. And then also how do you manage these chronic diseases that are just impacting their health care in really significant ways. We also have access issues because we don't have enough dentists around the state. So we're looking at different service delivery methods, portable dental services, portable screenings. We're also looking at how you can bring in trailers, mobile units, which have a lot of controversy associated with them, as well as mid-level providers into the workforce. And in Alaska, they've done some amazing work through Indian Health Service, this expanded dental assistant hygienist role, and it's a person who lives in that community in these very remote Alaskan villages who can actually do much, much more as a provider than a typical dental assistant or dental hygienist. So they created a whole new category. Minnesota's doing some exploratory research in this area as well. Arizona, we still have a lot of politics involved between the dentist and the hygienist. So you never escape that, no matter what area you work in. Politics are all local, as Mark Twain says. But those are the things we're trying to work through here, is how can we increase access to these remote areas and develop workforces. Teledentistry is giving us great access into communities and using the few dentists, especially pediatric dentists that we have, in a much greater way. So there's some good work being done here, but it is going to take us a little while.